I am going to go over Medicare and the different options that are available for everyone, and what possible things you can choose from, as well as some other information. So we are going to get started here. So who we are the State Health Insurance Assistance Program. We provide Medicare beneficiaries with free, unbiased information to assist them in making informed decisions about Medicare plan options and coverage. Our SHIP staff is comprised of 3 full-time staff members and about 25 volunteer counselors located across the state. Most of our volunteer counselors are part-time, which means they usually assist us during open enrollment, which is coming up next month. And then we have a handful that will assist us year-round. The SHIP services are available to North Dakota residents at no cost. The SHIP program remains busy year-round, but we definitely see a noticeable peak during the Medicare open enrollment, which is about to start on October 15th. And SHIP can also assist people with understanding your paperwork, your bills and statements. So like your explanation of benefits and statements that you get from your Medicare plans. We can also assist with claims and the appeals process with Medicare, as well as also Medicare Advantage plans. And then the other program that we assist with is long-term care. So if you have a long-term care insurance plan, we can assist with that. Like if you have questions about that regarding your premiums, or we can also assist with helping people appeal and or file a complaint if they are looking to start benefits and get a denial from their long-term care insurance company. So what is Medicare? Medicare is insurance for people who are age 65 and older. Also, hold on one second, I forgot to start this the right way. There we go. Sorry about that. Okay, so Medicare is for people age 65 and older, and also for people that are under age 65 who qualify due to disabilities. For some people that have disabilities such as ALS, which is Lou Gehrig's disease, or who have end-stage renal disease and or have a kidney transplant, will qualify right away without any waiting period. You can also qualify with other disabilities, but for those, there is a 24-month waiting period. So to qualify for something with outside of those other type issues, you would have to be receiving Social Security disability payments for at least 24 months before you would be able to start Medicare. And also to get Medicare, you must be a U.S. citizen or be considered a lawful U.S. resident. And you have to reside in the U.S. For 5 continuous years, which means for some people who immigrate to the U.S., they like to go back to their home country for at least part of the year. But in order to qualify for Medicare, you have to be, I believe it's only 60 days out of any given 12-month period that you can be outside of the U.S. in order to be considered continuous. So what are the agencies responsible for Medicare? The first one is Social Security. Social Security is responsible for enrolling the majority of people in Medicare. So to start with, you would go to Social Security, would contact Social Security to sign up for Part A and or Part B. The other ones are the Office of Personnel Management, known as OPM. These are for people who have federal retiree benefits. They still handle the retiree benefits for any federal employees. And then there's also the Railroad Retirement Board. That is for people who retire from the railroad. They actually would enroll people in Medicare if they are a railroad retiree. And then the biggest organization that handles Medicare is the Centers for Medicare and Medicaid Services, known as CMS. They administer all of the Medicare policy, and then they also administer like Medicare coverage, benefits, and payments. So laws for Medicare are actually passed by Congress, but those laws are enforced by CMS, and then CMS also does have some authority to pass rules specific to things that are within the law to give clarification. So the parts of Medicare, Part A, which is hospital insurance, and then Part B, which is medical insurance, and then Part D, which is your prescription drug coverage. And then we will go into those a little bit in more detail because there are some other things that they cover as well. So for your Medicare options, The first thing you would start off with is Original Medicare, which is your Part A and Part B. And then you would also add a Part D prescription plan to have coverage for your prescriptions. And then you can also choose a supplemental coverage, which most commonly is Medigap, which can help pay what Medicare doesn't pay for. However, you can also have other types of supplement, such as Medicaid, or if you still are working and your spouse is working, you could have secondary insurance through an employer or a union. When you have Original Medicare, you can use any doctor or hospital that takes Medicare anywhere in the US as long as they accept Medicare. They do not have to be in network, they just have to accept Medicare. Um, and then Medigap policies only work with Original Medicare. So if you choose a supplement like a Medigap plan, it would only be with Original Medicare. The other option, if you don't just choose Original Medicare, is the Medicare Advantage plans, which most people know as Part C. They are Medicare approved plans that are offered through private insurance companies that are basically an alternative to Original Medicare. They are usually bundled, so they include both Part A and B, and most of them also include your Part D prescription plan. And then they can also include some extra benefits like vision, dental, and hearing. They are usually, a lot of people will choose these options because they can also help reduce your out-of-pocket costs. So we will go over like what your costs would be with Original Medicare if you did not have any kind of supplement or a Medicare Advantage plan. With Medicare Advantage, you do have to make sure that the doctors you use are in network with that plan. And then the other thing that's different is that typically Medicare Advantage plans do have more requirements for prior authorizations for services. Okay, so how to enroll in Medicare Part A and B. Like I said, you would do that through Social Security. So you would contact Social Security to enroll in both Part A and B. You can do this when you first turn 65. Um, so you would, if you are receiving Social Security benefits for at least 4 months prior to turning 65, then you would automatically be enrolled in Part A and Part B. So you would actually get your what's called Get Ready for Medicare package, which would include your Medicare card and other information about 3 months before you actually turn 65, which I should say would be the month you turn 65. So even if you don't turn 65 until the end of that month, you would get them about 3 months before the beginning of that month. If you're under age 65 and have a disability, you will also automatically be enrolled in Part A and Part B after you're receiving Social Security disability payments for at least 24 months, or certain disability payments from the Railroad Retirement Board. You will also get your Get Ready for Medicare package with the same information about 3 months before you would hit that 25th month of disability. So when enrollment is not automatic is if you don't fall under one of those things, either getting your Social Security before you turn 65 or having Social Security disability payments for at least 24 months, then it is not automatic and you would actually have to contact Social Security to sign up for it yourself. And that you can start doing at least 3 months prior to the month that you turn 65. And then the same thing is true for if you are retired from the railroad, you can contact the Railroad Retirement Board at least 3 months prior to turning 65. One thing to note, which some people get confused about, is that the age for Social Security retirement benefits is 62. So you can potentially start receiving your Social Security benefits. You can choose to start getting them as early as age 62. However, unless you qualify due to disability, you would still not be eligible for Medicare until you actually turn 65. So when you can enroll in Medicare, so if you don't already have Medicare, there are a few different periods that you can use to enroll. You can sign up for Part A anytime that you're eligible. Your coverage would begin up to 6 months prior to when you apply, but it will not start earlier than you were first eligible for Medicare. So even if you apply earlier, like starting the 3 months, it would not start, for instance, until the month that you actually turn 65. And then if your first opportunity to enroll in Medicare Part A and B is during your initial enrollment period, which is for a total of 7 months. So it would be the 3 months prior to the month you turn 65, the month of turning 65, and then the 3 months following that month. And then if you don't sign up for Part B during your initial enrollment period, you don't have what's called creditable coverage, which I will explain, then you would have to wait until the general enrollment period, which is every year from January 1st through March 31st. And anyone can sign up as long as you're 65 or older. Anyone can sign up during the general enrollment period. However, the one caveat to that is that if you do not have creditable coverage and you did not sign up during your initial enrollment period, you would potentially have a late enrollment penalty for every 12 months that you did not sign up in which you were eligible. And then if you are already enrolled in Medicare, you would have what's called a special enrollment period, which would allow you to potentially change your coverage. This would be, for instance, the most common one for people, especially when they're first retiring, is if they still had coverage through their employer and or their spouse's employer. So if you have coverage through your employer or spouse's employer, and that employer has at least 20 employees, then you would not have to sign up for Part A or Part B right away. You could choose to defer it. And that is what's called creditable coverage. So at that point, you would actually get, like, when you decide to retire and no longer have coverage through yours or your spouse's employer, you would actually get a letter from your human resources person, which is called the letter of creditable coverage, that you would have to turn into Social Security when you enroll to show that you did have creditable coverage so that you would be exempt from the late enrollment penalty. A few of the other scenarios in which you would have a special enrollment period is if you move, including if you move, even if you stay in North Dakota, but you move from one county to another, you could potentially change your plan at that time. If you have a change in financial assistance, like if you qualify for Medicaid or extra help, you will have a special enrollment period, which I will go over later in the presentation. And then also if you move into an assisted living or a nursing home, then you would also have a special enrollment period at that time as well. If you already have Medicare and want to change your coverage, again, you would do that during the open enrollment period, which most people are familiar with, again, October 15th through December 7th. You can make changes to your Part D prescription plan and also your Medicare Advantage plan. So you can either choose to switch to a Medicare Advantage plan from original Medicare, or you can switch between other Medicare Advantage plans, and or you can switch your Part D prescription plan. If you change during that time, then that plan will not change and become effective until January 1st of the following year. If you have Medicare Advantage, you also have a second open enrollment period, which is January 1st through March 31st of each year. This would be if you already have a Medicare Advantage plan, you can switch to a different Medicare Advantage plan during that time, or you could go back to the original Medicare. And then if you made any changes during that time period, it would start the first of the following month. And then again, you would also at any time be eligible for those potential special enrollment periods that I mentioned. So the different parts of Medicare, Part A, which is hospital, which most people are familiar with, is it covers inpatient hospital care, but then it would also cover inpatient care in a skilled nursing facility. The one caveat to that is in order for Medicare to cover a skilled nursing facility, you have to have at least one related 3-day inpatient hospital stay. So I have seen people get caught up in this where they don't wind up getting their skilled nursing facility covered. And the reason for that is because you have to be admitted into a hospital, but your status has to actually be inpatient. Sometimes you're in the hospital, but the hospital actually classifies you as an observation or an outpatient care status. If they do that, even if you're in the hospital technically more than 3 days, it would not be, the skilled nursing facility would not be covered because your status has to be an actual inpatient. So we tell people that if this is ever a possibility for them because of like an injury or surgery, that they should double check with the hospital what their actual classification is. The other things it can cover is if you need any kind of blood transfusions as an inpatient, and that would only be if the facility is charged for the blood product by the blood bank. If the facility is not charged, then they cannot charge the patient for it. And then all hospice care is covered under Part A, and some home health care is covered under Part A. So currently for Part A, your costs, these would be your costs if you only have original Medicare and you have no supplement or Medicare Advantage. So currently for this year, the deductible for each benefit period is $1,676. And then after that, for days 1 through 60, you would pay nothing additional. And then days 61 through 90, you would have a coinsurance of $419 per day for each benefit period. And then days 91 and beyond, it would be $838 for each lifetime reserve day past the 90 days. And the lifetime reserve days is you're given up to an additional 60 lifetime reserves, which basically means if you ever have an inpatient stay that goes over 90 days at one time, then you would tap into those lifetime reserves and you only have a total of 60 across your entire lifetime. That's pretty rare. I haven't seen very many people at all that have one inpatient stay that goes more than 90 days. You can potentially have more than one benefit period in any given year because the benefit period is defined as where you have, like, once you're discharged from the hospital, as long as you're outpatient for at least 30 days or more, it would start a new benefit period. And then if you had private duty nursing, you would pay for that. And then if you have any kind of convenience fees while you're in the hospital, which a lot of the facilities here in North Dakota don't charge for separate convenience fees, like having a television or phone in your room. And then private rooms, if it's unless it's medically necessary, or unless that facility specifically does not have. Like, for instance, a lot of the hospitals in North Dakota are only private rooms. They don't have semi-private. So at that point, you would not be charged separate for the private room. And then skilled nursing facility, you pay nothing for the first 20 days that you're in care. And then days 21 through 100, you would pay $209.50 a coinsurance per day. And again, the benefit period is still defined as if you have at least 30 days or more outpatient without being in the hospital, it would start a new benefit period. And then days 101 and beyond, if it's in the same benefit period, you would pay all costs. Home health care, again, you would pay nothing for home health care services. If they have you get any kind of durable medical equipment like a shower chair or a commode, then you would pay 20% of the Medicare approved amount for that item. Hospice care, you would pay nothing for hospice care. Sometimes you might pay a small $5 copay for a prescription for like pain relief or something like that, but usually prescriptions and hospice care are covered under Medicare and you pay nothing. Medicare does not cover room and board when you get hospice care in your home or another facility where you live, such as a nursing home. It would only be if you actually go into a hospice care facility or if you get outpatient hospice care. And then again, blood transfusions, if you get hospital from a blood bank at no charge, then they would not be able to charge you for that as well. So, do you need to sign up for Part A? Part A is free for most people as long as you have at least the equivalent of what would be 10 years worth of work credits. Then Part A is free and you would not pay any type of monthly premium. You can pay for it if you do not have sufficient work history. You can pay a monthly premium for that. The premium varies. There are 3 different tiers depending on how much of a work history you have. And then if you do not sign up for Part A and you do have to pay for it, then you could potentially also have a late enrollment penalty if you don't sign up right away. And then if you have insurance through your employer or a spouse's employer, you could talk to your human resources person about whether or not to sign up for Part A. Usually if people, even if they have what's called creditable coverage through their employer, a lot of people choose to sign up for Part A anyway, since you don't have to pay for it. And it could potentially be like a backup in case you have, significant out of pocket with your employer plan that you might have to pay, then you could wind up having to pay less if you have Part A. The one caveat for this is that if you have an HSA account, like a health savings account, you would have to stop contributing to the HSA account at least 6 months before you're going to start Medicare, or you could have tax penalties for the amount you contributed within that 6-month time period. So for Part B is considered medical. It covers doctor services like your office visits, outpatient medical and surgical services and supplies. It would cover your lab testing, durable medical equipment like walkers and wheelchairs. One thing that a lot of people aren't familiar with is it covers, Part B is the one that covers your diabetic testing supplies and equipment. So for instance, if you have any like lancets or testing strips, or even if you have a continuous glucose monitor, those would all be covered under Part B. And then it also covers preventive services such as like your flu shot or your yearly wellness exam that you're eligible for every year. It does cover some home healthcare services, and then it would cover outpatient physical, occupational, and speech therapy, as well as outpatient mental health services. For Part B, currently for 2025, the monthly premium will be $185. We just received information from CMS that this is going to go up about $21 for 2026. So the potential would be about $206 for next year, would be the monthly premium for next year. The premiums could be higher if you did not choose Part B when you first became eligible. This is where the late enrollment penalty would come in. So the late enrollment penalty is 10% of the current monthly premium for every 12 months that you were eligible but did not sign up or have creditable coverage. It starts out, it can be fairly small, but I have seen instances where I've had a gentleman that was 83 and he had never signed up for Medicare, and he was looking at signing up for Medicare, and he was facing a very stiff late enrollment penalty because it's 10% indefinitely. So he would have basically been paying 130% because he had gone more than 13 years after he became eligible. The one thing that which I will discuss later is that if you qualify for one of the financial assistance programs, it will waive your late enrollment penalty for both Part B and the prescription drug plan. The other option, the other time you might have to pay more is if you have what's called the income related monthly adjustment amount, which means if you have a higher income, either individually or as a married couple, if your gross income is higher from your tax return 2 years prior, then you could potentially pay a higher premium. There are 5 different levels of the IRMA, which is called IRMA. The starting level currently for this year is $91,000. So you would have to be earning at least $91,000 or more to have an IRMA premium payment. And I believe the top tier currently starts, which is tier 5, currently starts at if you have a combined income of $750,000 a year or more. And again, these are based on your tax returns from 2 years prior. So for instance, if you were starting Medicare this year for 2025, they would be looking at your tax return for 2023. So if for some reason, especially due to retirement, your monthly income, your annual income is significantly less now as you retire than it was 2 years ago, you can file a dispute with Social Security telling them that you believe that the IRMA does not apply to you anymore because you don't make that kind of income. So for 2025, for Part B, if you have no other coverage, you would pay the annual deductible of $257. Again, that's going to go up a little bit for next year. And then once you meet the annual deductible, then Medicare would pay 80% and you would pay 20% for most covered services such as doctor's visits and stuff like that. And that is indefinite. So the 20% coinsurance is would always be the case. Most employer plans have a maximum out-of-pocket limit where if you reach that amount for that any given year, then you wouldn't have to pay anything more for the rest of that year. Medicare isn't like that. It's 20% across the board unless you have some other type of plan that helps cover it. Most preventive services have no coinsurance or copay. And again, if you have difficulty paying for these costs, you could potentially be eligible for the financial assistance programs that I will go over in just a little bit here. Next, we will talk about one way to help address some of the costs associated with original Medicare coverage. That is the Medigap policy. Medigap policies are sold by private insurance companies that help fill the gaps in original Medicare. Medigap policies can help you pay your share, which would be like your coinsurance, copays, and deductibles that are left over from Medicare. In all the Medigap policies, which are A through N, if the plan has the same letter of coverage, it is standardized, which means that Medicare CMS has specific guidelines that if a company chooses to sell a plan within that specific Medigap letter, it has to have the same benefits no matter how much they charge for that plan. And then each company decides which Medigap policies they will sell and the price for each plan. They do have to have a state review and approval, so they have to be licensed and approved in the state of North Dakota in order to sell any Medigap policies. Each type of Medigap plan offers different benefits. So for instance, like Plan A is different coverage from Plan G. North Dakota does recognize the federal rule of guaranteed issue rights for people aging into Medicare, which means you would have no pre-existing review. So that means you have guaranteed issue rights when you first become eligible or you first basically, so there's two ways. If you first turn 65 and you do not have creditable coverage, that would be when you first have guaranteed issue rights. And you would have up to 6 months after turning 65 to enroll in a Medigap plan with guaranteed issue rights, which means you wouldn't have to answer any kind of medical questionnaires. And then the same is true when you retire. So when you retire and you first sign up for Part B, that would trigger the 6 months that you would have to have your guaranteed issue rights. If you do not sign up for a Medigap policy during your initial enrollment period or your guaranteed issue rights period, you would have you'd have to go through what's called medical underwriting, which means they would have you fill out a medical questionnaire, and then depending on how you answer the questions, they could choose to refuse to issue a policy entirely or charge a higher monthly premium. I can tell you that some of the big ones that they automatically exclude coverage for. So if you ever had any kind of condition such as usually any type of diabetes, type 1 or 2, any type of stroke, and if you've ever been treated for a stroke, if you have any type of heart condition, if you have Parkinson's or Alzheimer's. I've actually had a couple people that called and told me when they tried to change their plan, they were actually denied coverage by several companies because they had a prior back surgery. Even though it had been 15 to 20 years before they had had any treatment for that, they were still excluded. So some companies have different guidelines as far as what they'll accept than others. So these are the different types of Medigap coverage. Like I said, they go A through G or A through D, F and G, and then K through N. Honestly, I have never seen anyone choose anything except for F, G, and N. I've never seen anyone choose the other options because the coverage benefits are a lot more limited. So Plan F and G are very similar. Plan F is no longer available. You had to be 65 prior to January 1st of 2020 in order to be eligible for Plan F. Plan G is the plan that replaced that. The only difference between F and G is that F pays for everything for both Part A and Part B. G, you would still have your annual deductible, so you would still pay that $257, but that would be the only out-of-pocket cost you would have under Plan G. And then Plan N is very similar to Plan F and G. The biggest difference is that under Plan N, you could potentially have a $20 copay for some office visits, and then up to a $50 copay for emergency room visits that do not result in an inpatient admission. The other major thing, though, is that there is what's called Part B excess charges, where some facilities or like providers, they don't accept Medicare allowed amount, so they are allowed to charge up to 15% above the Medicare allowed amount. And if you did not have one of these other coverages, you would be responsible for that excess charge. So Plan F and G will cover that excess charge for you, but Plan N does not. The other big thing with Medigap is that they do cover international travel. So they will cover foreign travel emergencies at 80% of the cost up to a lifetime max of $50,000. I will say as a caveat to that, I have actually seen where people have a Medigap plan like this and they still ran into issues when they were traveling internationally. I had a gentleman who was on like what he called his trip of a lifetime in northern Saskatchewan. He was 6 hours from civilization on like his light fishing trip that he was looking forward to, and he wound up falling through the seat of the boat that he was on and he broke his hip. And because of where he was, he had to be airlifted to the closest facility, which was about 6 hours away in Winnipeg. And they stabilized him and were going to try to transfer him to the closest US facility, which would have been in Grand Forks. But Grand Forks did not have the capability to do the surgery that he required. So he wound up having to stay in Winnipeg and had to have his hip surgery done there. And unfortunately, his medical bills were over $100,000 at that point. So the Medigap plan that he had did pay up to the $50,000, but he still had a very hefty amount left over. So honestly, as a person who's worked in insurance most of my adult life, I would still, if you ever do travel internationally, especially for like a significant period of time, it would probably be a good idea to also look at travel insurance that would cover medical expenses as well. So the best time to buy a Medigap plan, like we said before, is during your Medigap open enrollment period, which begins the month you turn 65 or older and also are enrolled in Part B for the first time. So when you first sign up, if you first sign up for Part B, when you first turn 65, you would have up to 6 months from that point to sign up for a Medigap without having to go through medical underwriting. And that means that the companies have to sell you a plan no matter what your medical status is, and they can't ask you about your medical status. The other time would be also if you're retiring. So if you're like if you choose to like not take Medicare Part B right away when you first turn 65 because you have your own employer insurance, then your open enrollment period would not start until you sign up for Part B, and then that would trigger the 6-month time period. You can also buy Medigap policy whenever a company agrees to sell you one. There's not a specific open enrollment period for Medigap. Technically, you could enroll in one anytime during the year. However, like I said, if you are not within your guaranteed issue rights, then they would have you fill out a medical questionnaire and can either deny the policy or have you pay a higher monthly premium. The next option that could help cover Medicare, original Medicare out-of-pocket costs is the Medicare Advantage plan. This is a lot of people know it in the market as Part C. They are offered by Medicare-approved private companies. So Medicare Advantage plans are regulated by CMS. The state doesn't have any regulatory authority over them. They have to follow guidelines set up by CMS, and they follow rules as far as how they can bill things and stuff like that. They are all private insurance companies. If you join a Medicare Advantage plan, you'll still have Medicare, but you will get your benefits for both Part A and Part B through the Medicare Advantage company that you choose. So it's more of a replacement plan where the Medicare Advantage plan you choose will take over paying for both Part A and Part B. And the majority of those plans also include your Part D prescription coverage, as well as some additional benefits like vision, dental, and hearing. And then again, you would want to make sure that the providers that you go to are in network with that specific plan. Pretty much all the plans in North Dakota are what's called PPO plans, which means there are out-of-network benefits. Some of the time they're the same, so there actually isn't a difference between in-network or out-of-network, but in some cases, if you go to an out-of-network provider, you might have to pay more. So in a Medicare Advantage plan, you are still with Medicare and you have all the rights and protections that Medicare offers. You have to live in their service area, which is typically decided by the county that you live in. So like in the state of North Dakota, the service area on how you determine what Medicare Advantage plan to choose is based on the county that you live in. Not every county has the same Medicare Advantage plans. You would still get those services that are covered by Part A and B, but the Medicare Advantage plan would cover those services instead. But you still have to have, some people are confused, you still have to have Part A and B. So you would still have to pay that Part B monthly premium of $185 in addition to your Medicare Advantage plan. You cannot be charged more than original Medicare for certain services, such as chemotherapy, dialysis, and skilled nursing facilities. So they can't charge you more than what normal Medicare would charge. And then you can also choose a plan that includes prescription drug coverage. When it comes to Medicare Advantage plans, we tell people the only reason that you should not choose a Medicare Advantage plan that includes a Part D plan is if you have other coverage that would potentially pay for your prescriptions. So for instance, if you have VA or TRICARE or sometimes Indian Health Services, then you could potentially choose a Medicare Advantage plan that does not include a Part D plan. Otherwise, you would want to choose one that includes a Part D plan. because otherwise you would not have coverage for your prescriptions. The benefits and cost sharing can be different. Usually under the Medicare Advantage plan, you would have a various different copays for all the different services that they cover. They also have extra benefits like the vision, dental, and hearing. Pretty much all the Medicare Advantage plans offer those types of services to one degree or another. They do vary as to how much they pay. Typically, all vision, dental, and hearing has a maximum that they will pay for per year, but again, they differ between the two plans. And then a lot of them also like cover gym membership reimbursements. And then under the Medicare Advantage plan, you do have an annual out-of-pocket limit. So you would have a max out-of-pocket limit. And if you ever reach that amount, then you would not pay anything for the rest of the year. So when you can enroll in a Medicare Advantage plan, if you have Part A and enroll in Part B during the general enrollment period, you can also sign up for a Medicare Advantage plan during that same period, which would be January 1st through March 31st. And then that coverage would begin the first of the following month after you enroll. If you're new to Medicare, you can choose to enroll in a Medicare Advantage plan when you first start Medicare. So basically during your first initial enrollment period, you can choose to start enrolling in Medicare. So that would be within 3 months of having Medicare. It's a little different than Medigap. So that would still be like the same window, that same 7-month window. So you would have up to 3 months after you turn 65 to sign up for a Medicare Advantage plan. And then if you are already enrolled in either original Medicare or a Medicare Advantage plan, you can choose to change it either during the fall open enrollment period, October 15th through December 7th, or you can choose to change it during the Medicare Advantage open enrollment period, which again is January 1st through March 31st, and again would start the first of the month following the month that you change. And then again, if at any time you qualify for a special enrollment period, such as gaining or losing Medicaid or extra help, moving out of your service area, or moving into or out of like a skilled assisted living or nursing home, then you would also qualify to be able to change your plan. So in some parts of the state, there is one other option that you can have, which is the Medicare cost plans. Currently, there are 4 counties that do not have Medicare cost plans. The 4 counties are Burleigh, Morton, Stutzman, and Grand Forks County. If you live in any of those 4 counties, the cost plan is not available to you. If you live in any of the other counties, it is an option. Most of the time, the cost plans that are offered are through the company called Medica. They usually have several different cost plans. You can join a cost plan even if you only have Part B. So this is the only Medicare type plan that you can choose, even if you just choose to have Part B and you don't have Part A. And this would only be the case if someone did not qualify for Part A with premium free. So if you had to pay for Part A, some people might choose not to pay for Part A and just get Part B. And then if you have Part A and Part B and you go to an out-of-network provider, the one thing that's different about the Medicare cost plans is that your services for the out-of-network provider would actually revert back to original Medicare. So Medicare would actually pay for any out-of-network service provider that you had coverage for. So then you would actually be subject to the original Medicare benefits for either Part A or Part B, which would be the deductibles and coinsurance that they have. And then you can leave anytime and return to original Medicare. So again, the cost plans don't specifically have an open enrollment period. You can change them during like the fall open enrollment period, but you don't have to. You can actually, if you decide that you don't like your cost plan, you can choose to go back to original Medicare at any time during the year. And then with the cost plan, you have the option of choosing a cost plan that includes your Part D coverage, or you can choose a cost plan that does not include the Part D coverage and then get a separate standalone Part D. And in this case, we actually see most people do it with a separate standalone Part D because for some reason, the cost plans that include prescription coverage usually are more than, like the monthly premium is more than if you would choose the cost plan without it and then like get a separate standalone Part D. That's the only time you can do that if you either have original Medicare or cost, but not Medicare Advantage. So the cost plans Oh, here, I guess that's, and then the cost plans again are offered by private insurance companies, but they also are under the regulation of CMS. So CMS has to be the one that allows them to sell their plans in any given state. They have to submit information to Medicare. And cost plans are only available in the more rural areas. So they haven't disclosed to us what the specific guidelines were. It was this like not this year, but 2024 was the first year that those 4 counties lost their cost plans. And it was because, from what they told us, it was because there was a certain percentage of people that were eligible for Medicare in those counties who had signed up for a Medicare Advantage plan. And once it like hits that threshold of a certain percentage of eligible people that have a Medicare Advantage plan, then they no longer allow cost plans to be sold in that county. It's kind of odd that some of the larger counties like Ward County and Cass County still have them, and it's because they just haven't reached the threshold of how many people have signed up for Medicare Advantage. So the next thing we will cover is the Medicare Part D, or your prescription drug plan. They say that Medicare says it's considered an optional benefit available to all people with Medicare. In all reality, it really isn't optional unless you have, like I said, VA benefits or TRICARE or IHS, something else that will already pay for your prescription drug coverage. Because if you don't have a Part D plan, then you would have no coverage for your prescriptions. And if you did not sign up for Part D, either during your initial enrollment period or like when you first retired and lost coverage through an employer plan, then you would also have a late enrollment penalty. The current late enrollment penalty for the Part D is 1% of what the national average is for every month that you were eligible for coverage but did not take it. So it starts out small. So currently the monthly premium, the national monthly premium average is $37.67. So it's just under 38 cents a month. That would be potentially your penalty, which wouldn't be bad if you only went like, a year or even a couple years without it. You would have a pretty small penalty. But I've seen people that have gone 5-10 years without ever having coverage because they thought, well, I don't take any medications, or I only take 1 or 2 really cheap medications, so I'm not going to pay for a Part D plan when I'm not going to use it. But then they wind up having to potentially pay more later because they have a significant late enrollment penalty. And honestly, at this point in time, we always recommend that people sign up for a Part D plan, because currently in the state of North Dakota, there is a plan called WellCare Value Script that has a $0 monthly premium. So there's no reason not to have a Part D plan, because you're not paying anything for the plan, but you'd still have coverage to fall back on if you ever did have to start taking medications. Or for instance, if you got sick and had to have an antibiotic, or you had an injury and had to have some kind of, pain medication or something prescribed. So really, there's no reason not to have a plan when you're basically not paying anything for it at all. And again, you can get they are all run by private companies that contract with Medicare. So they all have contracts that they sign with Medicare. They all have various different monthly premiums, like I said, but there's one that has a $0 monthly premium. And you can choose the standalone drug companies, the standalone Part D. You can choose the Medicare Advantage plans that include prescription drug coverage. And then you can also have the Medicare cost plans that include the prescription drug coverage. And honestly, when I say that, if you have VA coverage or TRICARE, we usually, especially because I have seen instances where people have had VA or TRICARE and something happened and they had to have a really highly specialized medication, like one of the new biologics, and it either wasn't available through the VA or TRICARE, or they wouldn't cover it. It is still helpful to have a Part D plan as a backup, especially, like I said, if you're going to have a $0 monthly premium plan, it's a good idea just to have it just in case you ever need it. So how the Part D plan works, again, it says it's optional, but the caveat to that is if you don't have any other prescription drug coverage and you wind up needing it and you don't sign up right away, you will have a late enrollment penalty. And I did forget to mention, the late enrollment penalties are a lifetime late enrollment penalties unless you qualify for one of the financial assistance programs that I'm going to discuss that would waive the late enrollment penalty for you. So each of the different plans have a separate formulary, which is the list of drugs that they cover specifically. And this is actually true. So most of the companies actually have at least 2 or sometimes even 3 Part D plans that they sell in the state. But even there is a difference between the formularies, even with the same company, between the 2 plans that they have. So that says that they are required to include a range of drugs in each category. The reality of that is, especially when you get into the more highly specialized or newer drug classification categories, there usually only might be one medication. So especially like in the biologics, they might only have one drug that they cover in that category. And then they are subject to change, so they can actually change their formulary at any time during the year, but you would have to be notified ahead of time. They would send you a letter to let you know that they would be changing it. Unfortunately, I'm not really sure why they allow them to change it during the year, because unless you qualify for one of the special enrollment periods, you can't change your Part D plan. And if they change your formulary and it's suddenly the prescription that you take either isn't covered suddenly or has a much higher out-of-pocket cost, that's unfortunately not a special, that's not a categorization for a special enrollment period that allows you to change. Usually though, we see the biggest changes happen to the Part D formularies just prior to open enrollment. So coming up, like right now, they're making their changes to their monthly premiums and their formularies and how they're going to cover things so that they're ready for open enrollment next month. I've actually seen changes go right up until open enrollment actually starts. And then your out-of-pocket costs can be less if you choose a preferred pharmacy. So there are 3 tiers for pharmacies. So the first tier is completely out of network. That would be like if the pharmacy is out of network entirely, you would have absolutely no coverage for your prescriptions. The second tier is what's called a preferred, an in-network pharmacy. So a lot of pharmacies in the state of North Dakota are what's called the in-network. So they still cover it, but sometimes the cost might be a little bit higher. The least costly tier is usually what's called the preferred pharmacies. So in the state of North Dakota, the majority of preferred pharmacies are any of the Thrifty White locations or CVS. In the eastern part of the state, like where, especially like along East Grand Forks or in Moorhead, you would also have access to like Walgreens, which is a preferred pharmacy. I have seen in some of the smaller counties that there is a few of the local pharmacies that are actually classified as preferred. And I've actually seen some of the local pharmacies actually beat the price of, for instance, like Thrifty, White, and CVS and actually be cheaper. It's not very often, but in some of the smaller counties, I think they compete more because of the fact that, you know, they're like, they kind of have to, because otherwise they would lose a lot of customers. And then if you have limited income and resources, you can qualify for one of the financial assistance programs, which is called Extra Help. And I will go over the specifics on the Extra Help program in just a few minutes here. Again, if you have Medicare prescription drug coverage and a higher yearly income, you would also have the Part D IRMA. So if you have IRMA under your Part B medical, then you would also have IRMA that would apply to Part D, but it's different. It's much smaller amounts for that. And again, that would start at the $91,000 mark. And if anyone has any questions about IRMA, like specifically as it relates to them, you can just let me know and I can like actually look at, you know, what your potential might be if you think that you might like fall into one of those ranges. So then for the Part D late enrollment penalty, you might have to pay more if you choose to wait to enroll, unless, like I said, you have creditable drug coverage, which would be if you're enrolled in an employer plan through either yourself or your spouse, and the employer has at least 20 employees. Or if it would be waived if you did have a late enrollment penalty. Your late enrollment penalty would be waived if you qualify for Extra Help. And the late enrollment penalty applies if you have at least a continuous period of 63 days or more after your initial enrollment period in which you have no prescription drug coverage. So Medicare, like I said, calculates the enrollment penalty 1% of the national average. Actually, I guess my correction, the national average is $36.78. So it's about 37 cents a month that you would be looking at for each month that you did not have coverage but were eligible. And then that amount does change. So that national average will probably go up again a little bit next year. So then the potential for your late enrollment penalty would go up a little bit each month as well. And then, so your Medicare Part D plan is the one that would actually notify you if you were eligible for a late enrollment penalty. So if they see that you are not eligible for a late enrollment, that you are eligible for a late enrollment penalty, then they would potentially, so you most likely would have to submit that letter of creditable coverage also to your Part D plan so that they could see that you had coverage if you sign up after your initial enrollment period and you still had insurance through your employer. So when to enroll in a Part D plan. So you can, like again, sign up during your 7-month initial enrollment period, which starts 3 months before the month you turn 65. Or you can sign up, switch, or join during the open enrollment period, which again is October 15th through December 7th. If you make any changes to your prescription plan during that time period, then the new plan would start January 1st of the following year. Generally, you must stay enrolled for the entire calendar year. However, there are some situations that would allow you to join at other times, such as when you switch from Medicare Advantage to Original Medicare. If at any time during the year you do that, then you would also be able to switch, you switch back to Original Medicare, you would also be able to enroll in a standalone Part D prescription plan. And then also, again, if you ever qualify for any of those special enrollment periods that we discussed. And then I will discuss this one as it relates to this. There's also a separate special enrollment period if you qualify for one of the assistance programs. So then we are going to go over for what help is available for people with limited income and resources. So these are the programs that are available to people with limited income and resources. They are the Medicare Savings Program, Extra Help, and Medicaid. You should apply for these programs if you have limited income and resources, or if you think. So sometimes if you're on the edge of, if you think that you might qualify based on like the income or assets, it's a good idea just to apply anyway, to see if you might qualify, because they sometimes use different algorithms, especially Medicaid uses different algorithms as to what they consider a qualified expense or what a qualified income. So for instance, the Medicare Savings Program, this is a program that provides help from the state paying for Medicare costs. It's actually a joint program through the state and the federal government. It can help pay for your Medicare monthly premiums, and then depending on which tier you qualify for, it can also potentially pay for your deductibles, co-insurance, and co-payments. It has a higher income limit and resource guidelines than full Medicaid. And then this one, the Medicare Savings Program, is you would actually apply through the Department of Health and Human Services. So for instance, like your local social services office, which is the same area that you would also apply for Medicaid. Extra Help is the program specifically related to your Part D prescription plan. This can help people pay for your actual Part D monthly premium, as well as also reducing the costs of the prescription. So your copays would actually be significantly less if you qualify for Extra Help. It's also known as the low income subsidy. Some people with Medicare have to apply for Extra Help. Sometimes you would automatically be enrolled. So if you qualify for a Medicare Savings Program or Medicaid, you would actually automatically be enrolled in Extra Help as well. Extra Help is administered by the Social Security Administration. So it is a federal program, and they are the ones that administer it and determine eligibility. And then Medicaid, again, is a joint federal and state program, and that has different income. That has the lowest income and asset limits for people. But there are also, Medicaid is the only financial assistance program that could potentially help pay for assisted living and or nursing home costs. And the guidelines are much different if you're looking at qualifying for Medicaid because of assisted living or nursing home. They have much different guidelines as far as income and assets for that. It gets a little bit more complicated for that. And so we usually refer people to our counterparts at the Department of Health and Human Services to help people figure out if they would qualify for that based on needing assistance for nursing home or assisted living. So like I said, with Medicare Savings Program, it's administered by the Department of Health and Human Services. The limits might change. They usually change every year. So they go up. The income and asset limits go up every year. For some reason, they don't actually release the new income and asset limits for the year until at least February, sometimes March of that year. So if someone calls us right away at the beginning of the year to find out if they qualify, we might not be able to tell them for sure because, if they're on the edge, they might be able to qualify depending on how much they raise the income and asset limit. So the levels are the top tier level, which has the most benefits, is QMB, Qualified Medicare Beneficiary. This one will pay for Part A monthly premiums if you are required to pay for them. It pays for your Part B premium, and then it also pays for all of your deductibles, co-insurance, and co-pays. The monthly income limit for this is $1,325 for an individual and $1,783 for a married couple. And then the resource limits are $9,660 and $14,470 for married couples. And then you would also qualify for extra help. And then the second level is SLMB, so that's Specified Low Income Medicare Beneficiary. This one would just pay for the Part B monthly premium, so that $185. Again, the income limit for an individual is $1,585 and married couple $2,135. And the resource limits are the same as the other one. And again, you would qualify for extra help. And then the last tier that's most common is QI, Qualifying Individual. That one's actually the same as the SLMB, where it would just pay for the Part B monthly premium, but the income limits are a little higher at $1,781 for an individual and $2,400 for a married couple. Asset limits are the same. The difference between SLMB and QI is that QI requires you to recertify every year with your income and asset limits. And again, you would also qualify for extra help with that. The last one is for qualified disabled working individuals. That one I've never actually seen anybody have, so I'm not really going to go over that one. If anyone has specific questions with that, you can let me know. Then extra help is the one specific for prescriptions. This is a federal program, like I said, also known as the Part D Low Income Subsidy. It helps pay your Part D monthly premium, but then it also reduces the costs of your prescriptions, and it eliminates the Part D late enrollment penalty if you would have been required to pay one. So this one has the highest income limit at $1,976 for an individual and $2,664 for a married couple. Asset limits are also higher at $17,600 for an individual and $35,130 for a married couple. So the copays for this year for generic medications are $4.90, and for brand names are $12.15. However, if you qualify for Medicaid or the QMB version of the Medicare Savings Program, then your copays would actually be even lower. So they would be $1.80 for generics and $4.90 for brand names. Medicaid, again, like I said, is a federal and state program that provides coverage for people. So usually if you qualify for Medicaid, it would actually pay for your all the out-of-pocket costs that are left over from Medicare. You can actually qualify for both Medicare and Medicaid. If you do, you are considered what is called dually eligible. And there are actually some Medicare Advantage plans in some of the counties that are specifically geared towards people that are dually eligible that have some additional benefits, like over-the-counter cost benefits and stuff like that can help assist people that qualify for Medicaid. Medicaid can also, like I said, cover services that Medicare does not cover, like long-term care, like assisted living and nursing home care. And they also pick up, like I said, out-of-pocket costs from Medicare. Medicaid is always the payer of last resort. So no matter what you have, they would always pay the last. And again, Medicaid can provide premium assistance, but that's actually through the Medicare Savings Program. And Medicaid can provide additional cost sharing, like for instance, like the QMB, which again is actually the Medicare Savings Program. And then again, if you qualify for Medicaid, you would also qualify for extra help for your prescriptions, and you would automatically be enrolled in that. And then if you qualify for this, you would get a special enrollment period that would allow you to change your Part D prescription plan once per quarter during the first 9 months of the year. And again, it would eliminate any Part D late enrollment penalty. So just one mention about our counterparts at the North Dakota Senior Medicare Patrol. They are the organization that is a nationwide program that helps seniors prevent, detect, and report Medicare fraud. So they educate seniors on how to spot fraud, and they also help with reporting activity to authorities. So if you ever think that you are possibly been a victim of Medicare fraud, we would actually direct you to our counterparts at the Senior Medicare Patrol, because they will file a report with Medicare regarding, like, for instance, like if you think someone has your Medicare number or something like that. That's one of the most common Medicare frauds, is like if someone gets a hold of your Medicare number and starts using it, or if they start billing things, like we see sometimes they bill catheters for people who have never used or needed catheters. So we do tell people to protect yourself, regularly review your Medicare statements to make sure there aren't things on there that were some kind of services that you've never even had, and to make sure you keep your Medicare card number secure. Do not ever give your Medicare number out to someone that just randomly calls you on the phone, because there are some frauds where the scams where they're trying to trick people into giving out their Medicare number, and they act like they're, you know, a company like a Medicare Advantage company, but it's actually a fraud trying to get a hold of people's Medicare numbers. And then these are a list of our helpful resources, which you don't need to, you know, copy that. I know this is going to be available online for everybody to look at. And then this is how to contact us.